Good evening. Welcome to our Guardian Facebook Live once again. My name is Jeffrey and this is my colleague Sarah, and we are both pharmacists from Guardian.
Today we'll be sharing on the topic of probiotic. We will be taking you through the facts of it and hope to dispel any common myth and misunderstanding that you may have. If you have any burning questions, feel free to leave a comment below and we'll try our best to answer you. Alright, let's get the ball rolling. Jeffrey, what exactly is probiotic and what do they do?
Okay, in essence, probiotics are live microorganisms that are intended to have health benefits when consumed. Our human gut is actually colonized by many microorganisms, including bacteria, yeast, fungi, etc. These microorganisms, collectively known as our gut microflora, can affect the human health and diseases.
Yes, probiotic works by colonizing our gut and exerting various health effects such as aiding in digestion, strengthening our gut, and also inhibiting the growth of bad bacteria. Hence, probiotic is also known as good bacteria.
They are also known to be beneficial to prevent, manage, and reduce the severity of a few health conditions. Examples include acute diarrhea, antibiotic-associated diarrhea, and irritable bowel syndrome. Probiotics may also help to strengthen our immune system.
Wow, it's amazing to think about how this small microorganism can do so much for our body. Now, it then begs the next question. How much probiotic do we need in a day, and is it true that the more the merrier?
That's a very good question, Sarah. But first, we need to examine how the number of probiotics are calculated in a product. Colony forming units, or CFU in short, is a measurement unit to estimate the number of viable live microorganisms present in each tablet and capsule. Generally, probiotic supplements contain millions to billions of CFU, and some may even go as high as 100 billion CFU.
Yes, although it sounds like a lot, our digestive system is actually loaded with trillions of bacteria, hence it's quite difficult to overdose on probiotic.
Yes, you're right. Now back to your question, it's not always true that the more is better. Research has shown that there is little point in talking about the strength of the probiotics if it cannot survive well in the stomach acid, or if it cannot adhere to the gut wall in order to colonize or do its job. It's hence important to consider the quality of the strain and the combinations of strains instead of focusing on how high the CFU is.
I see. Indeed, there's a lot of probiotic out there in the market and it can be very confusing to decide on which one to choose. Let us break it down for you. Firstly, we need to know why you are taking probiotics. For example, is it for general digestive health? Is it to support the immune system? Or is it for IBS, frequent diarrhea, etc.? This is because different species of probiotic confers different health benefits.
Yes, so in general, the common probiotics are Lactobacillus and Bifidobacterium. Both of them are considered as a genus, which is aka a family. So within each family, there are different species, and some species have more research to it, while others may not be that well researched.
For example, one common probiotic species that you might have heard of is Lactobacillus Acidophilus. So Lactobacillus is the genus name and Acidophilus is the species name. In short, they are also known as L. acidophilus. This probiotic is well researched and it's able to reduce the duration of diarrhea, helps with irritable bowel syndrome and also vaginal health.
Yes, so another probiotic called B. longum is actually well researched to alleviate constipation, whereas probiotics like L. pentherium and L. paracaside are known to boost our immune system. Other strains like B. infantis and B. breathed have more studies done in the children's population to help prevent and treat pediatric diseases.
And for women's health, you might want to look at for these two strains. It's L. raminosus and also L. uteri. Now, to summarize, it's important to choose a probiotic product that targets your purpose. We do understand that the probiotic's name and strain can be very confusing.
Yes.
Even we ourselves have difficulties with the name. So to make things easier, when choosing a product, look at the description box. Usually it will tell you what condition it targets and which area it may help in.
Yes, you don't have to stress over the probiotic names. Just look at the description box or check with your healthcare professionals for advice. The last point to note when choosing probiotics will be to decide if you want to have additional ingredients included to aid your specific purpose, such as digestive enzymes to improve your digestion, or even cranberry extract to prevent urinary tract infection.
We hope that this tip will help you to choose your probiotic next month. Moving on, it's time to burst another myth. I'm sure you have heard that probiotic must be stored in fridge. What do you think, Jeff?
Well, it's not true that all of them requires refrigeration. Improvements in the manufacturing processes known as lyophilization, also called dry freezing, greatly increases the stability and the shelf life of probiotics without refrigeration. It's still as effective, and some probiotics are dual coated to ensure high survival rate inside the gut. For probiotics that do not require refrigeration, it's still important to keep them in a cool and dry place because high heat can still reduce the number of viable bacteria in the product.
To add on, probiotics that require refrigeration are also staples out of the fridge for several days too. Please check out with our friendly pharmacist in store for additional information if needed. Jeffrey, do you remember I've mentioned about probiotics benefit for antibiotic-associated diarrhea at the start of this live chat? Now, why do you think it's good to take probiotic when someone is on antibiotic course, and is it okay to take them together?
Yes, it's beneficial because antibiotics do not know the difference between the natural friendly bacteria that live in our gut from the bad ones that cause you to be sick. They kill off both the good ones and the bad ones at the same time. So this may result in some side effects such as diarrhea. So taking probiotics will be able to rebalance the gut microflora once again. So the recommendation for taking probiotics with antibiotics is to at least take them 2 hours apart or try to space them as far apart as possible. This is to prevent the antibiotics from killing the probiotics directly.
That is totally correct. To add on, these two specific probiotic strains are L. acidophilus and L. rhamnosus has also shown to reduce the incidence and duration of antibiotic-associated diarrhea.
Okay, before we move on, we'd like to mention that Guardian is actually doing a giveaway during the whole Q&A session. So please do check out in the details in the comment section and do let us know and let us check if there are any questions yet. Do we take it before or after meal? You want to do it?
Do you want to do it?
Okay, never mind, I can do it lah. Okay, so we have one question that says, should we take the probiotics before or after food? And does it matter the time when we take them? Well, it actually really depends on the brand of probiotics that you buy, because it's best to follow the specific instructions that the box that you buy. So unless it's not specifically stated, right, there are some general guidelines that you can follow, right? So you can see if you are stated that the probiotic product is actually what we call enteric coated, it means that there's a protective layer, right, to be able to so-called ensure that it's able to survive in the stomach acid and to make it into the gut for colonization. Right, so these enteric coated ones, right, should be able to take with or without regards to food. But for those that are not so-called coated, right, I think it would be best to take them with meals for greater survival rates of the probiotics.
Yes, indeed.
I think we can move on. Okay, let's move on. So some of our viewers, right, may be interested, right, to know if probiotics are actually safe for kids. So what do you think, Sarah?
Yes, they are. Probiotics are generally well tolerated and have been safely used in infants and children. Studies have shown that there are many benefits in using probiotics in children, such as promoting overall gastrointestinal health, reducing the duration of diarrhea caused by food poisoning or antibiotics, and it also helps to prevent infant colic, constipation, and acid reflux when first given the first 3 months of life.
Wow, there are so many benefits of using probiotics in babies and children. They come in several child-friendly formulations since they can't swallow capsules or pills.
Yes, and in Guardians, we have them in chewable tablets or gummy for kids generally 4 years and above who are able to suck or chew on them. For younger children, we also have probiotics in liquid forms and powder forms where you can feed them directly through the mouth or mix them in room temperature water before feeding them.
Okay, do drop by our stores to check out the different formulations of probiotics available for your child. However, to take note, if the child has compromised immune system, for instance, if the child is seriously ill or if they are premature infants, probiotics may not be suitable for them as it may put them at risk for infections. So hence parents should always talk to their healthcare professionals before using.
Yes, it's always important to check with your healthcare professional before starting on any supplements, medication, not just probiotics.
So Sarah, having to know so many good things about probiotics, right? What do you think are some of the side effects to take note of when people is taking probiotics? So once, right, there's a customer who came and told me that he's tried it once before and they developed wind during the first few days. So do you think it's normal?
Well, Jeffrey, it's common for people who are using probiotic for the first time to experience gas, bloatedness or diarrhea. Now, this is due to the changes in our gut microbiome flora, which can cause the bacteria to produce more gas than usual, hence causing the bloatedness. However, these side effects are usually temporary and are usually clear up within the first few weeks or first few days or first few weeks after taking them, because it takes some time for the guts to adapt.
Indeed, my bloatedness, they go away for a week. However, if the symptom persists, do speak to your healthcare professional to explore the other possible causes. In some cases, switching to a different probiotic brand may help too.
Also, it's very important for anyone with allergies or intolerant to gluten, soy, eggs, dairy, lactose to exercise caution when choosing probiotics. This is because these allergens may be found in certain probiotic brands.
Oh, I see. That's good to know. By the way, I also received quite a number of queries from customers asking how long do probiotics take to work before they can see the effect. So what are your comments on it?
Well, it's a tough question to answer because it really depends. In recent study, it has been found that many factors can affect the effectiveness of probiotic, such as the type of probiotic strain, the dose, and also your personal health status. In addition, the condition or symptoms that you're trying to treat may determine when you see the result as well.
That's right. For example, if you're taking a probiotic for acute diarrhea, you may see the improvement in just a few days, as compared to taking probiotics for general gut health or the immune health. You probably need to take it for a longer period of time to see the results. So hence, depending on what you're looking for, you may see the symptoms improvement anywhere from between a few days to a few months.
I also understand that there may be times where we feel that the probiotic is not working or that it's taking a longer time to work. Now, a few more reasons why probiotic may not work are that you are taking the incorrect types of probiotic strain that do not target your concern, insufficient CFU count, or it could be due to the incorrect storage of probiotic leading to reduction of its efficacy.
There are many factors that's being involved. So for chronic conditions, generally, if you don't see any improvement after taking the probiotics for about 1 to 2 months, you might want to consider changing your probiotic brand or try a higher dose of it.
Another question is regarding about probiotic is whether can you take probiotic every day and can you take them continuously for a long run?
Okay, so generally, right, it's definitely safe to take probiotics daily as a supplement, right? So probiotics can be used to support our gut health and also for immunity as part of a healthy lifestyle. Some of us may also take probiotics periodically whenever we feel like we need a little support, such as during an episode of diarrhea or acute food poisoning.
Furthermore, there are many factors that can affect a normal flora in our gut, such as consuming food that contains chemical and also stress. Hence, a daily top-up of probiotic might be a good idea for many people. Some of us may be concerned that our digestive system becomes lazy if we take probiotic every day, but there's no research that suggests that body becomes dependent or addicted to probiotics.
Another thing that some may be concerned about is if there are certain medications that shouldn't be taken together with probiotics. So one example would be to avoid taking oral antibiotics and antifungus together with probiotics, as they may reduce the efficacy of the probiotics if they are taken together at the same time.
Yeah, in addition, if you are taking medicine that says avoid food, like thyroid medication, it's best to keep your probiotic away from this medicine so that it does not interfere with the medicine absorption. Now, it's recommended to space out this medication with probiotic by at least 2 to 3 hours.
Probiotics should also be used cautiously in patients with weakened immunity, such as those taking immunosuppressants or undergoing chemotherapy, since probiotics are actually live bacteria, so they can cause infection in these immunocompromised patients.
Now, if you are unsure, you should always approach our pharmacist or any healthcare professional to clarify. Now, before moving on, let us check if there's any questions to answer.
Don't have. Okay. Seems like we can move on, right? So I guess some of you, right, may be interested to know what natural food actually contains probiotics. There's a long list, but some of the common examples include Yakult, yogurt, tempeh, which is a kind of fermented soybean product, kimchi, raw cheese, and fermented vegetables such as pickles.
However, not all fermented food contains live probiotic. In order for this food to confer a probiotic benefit, the probiotic must be alive at the time of consumption, and this can be very challenging as some probiotic may be lost during food processing and storage.
Yes, there are some pros and cons to consume probiotics containing food versus a probiotic supplement. So one benefit of eating natural food containing probiotics would mean that you get additional beneficial nutrients such as your vitamins, your minerals, and also prebiotics, right? So furthermore, there may be a wider diversity of probiotic strands that are actually found naturally in food.
Yeah, on the other hand, fermented food may contain allergens and have strong flavors which may not be enjoyed by everyone, and the amount of probiotic present in the food is unknown as they can be lost during processing and storage. Generally, very low amount of probiotics are found in food as compared to supplements.
Yes, so for probiotic supplements, right, the number and the type of the strains can be easily controlled. Since different types of probiotics have different functions, this can be beneficial if you're looking for a specific health outcome.
taking probiotic supplements can be more convenient as some of us lead a busy lifestyle or have limited access to probiotic containing food. However, do note that probiotic supplements may cost more than probiotic containing food.
Yes, so if you prefer taking a probiotic containing food, here are some helpful tips for you to ensure that your food actually contains viable probiotics. Firstly, when you buy yogurt, right, do not assume that all yogurts actually contains live probiotics.
Oh.
Yeah, so you need to make sure that the container actually says live or active cultures.
I see. And if you see a product that has been pasteurized, it means heat treated. Now, live bacteria are probably killed by the heat, so be sure to choose those that are unpasteurized.
Also, to take note that pickles using vinegars do not have probiotic effects. So look for fermented pickles rather than the one made with vinegar. This is because vinegar preserves food by preventing bacterial growth. So hence both the good and the bad bacteria are destroyed.
Ah, that's interesting to know. Alright, we have now come to the end of the discussion on probiotics. Let us check the comment section to see if there's any more questions.
Okay, seems like some of our viewers, right, have also actually submitted their questions last week via Instagram story, and we'll be answering them live today. You want to take one of it? Okay.
So, we have a question: what is the difference between pre and probiotics? Now, probiotics are living strands of bacteria that lives in our gut and promotes the our healthy digestion. Whereas prebiotics are actually specialized carbohydrates that are found in fiber-rich foods and vegetables that are not digestible by our body, and they're also food for our probiotics. Now, it's important to note that all prebiotics are fiber, but not all fibers are prebiotics. Now, you can get prebiotics from food such as banana, asparagus, onions, and garlic. Now, some products also combine prebiotic together with probiotic to ensure that the probiotic has their food for them to survive and replicate.
Okay. And also there are some questions asking whether if probiotics are actually safe for pregnant and breastfeeding women, right? So probiotics actually do not appear to pose any safety concerns for pregnant and lactating mom, as because the systemic absorption is rare when the probiotics are actually used by healthy individuals. And the current evidence does not indicate that there's an increased risk or increased risk in the adverse pregnancy outcomes, right? However, expectant moms, right, who are considered more at risk, or those with health conditions, especially related to their immune system, should always check with their gynecologist before taking any supplements, including probiotics.
Now, next question is, how is it different from getting probiotics from fruits than supplementing? Now, fruits usually provides prebiotics. Now, like fiber, if you are looking for probiotic containing food, like what Jeffrey has mentioned, choose yogurts, kimchi, tempeh. Now, the differences has been discussed before, but the main ones are actually the amount of probiotics in food that is unknown, because some can be lost during processing and storage, and that as compared to supplements. Now, supplements, they are better controlled and the quantities are much higher.
Right. Also, we have one question about is postbiotics, right, different from is postbiotics different from postbiotics? Yeah. So because that's a very good question, because up until now, right, we have only mentioned about the two items, which is the prebiotics and the probiotics. Right, so probiotics are actually the live organisms, and prebiotics are actually the food for them. So right, now the postbiotics are actually the metabolic byproducts that are being produced by the probiotics, and they are considered so-called like the waste products of the probiotics. But it's still a very new term in the biotics field, right? And there are preliminary research has shown that it's beneficial to the body.
Yeah, it can be quite confusing, post and probiotics and prebiotics.
Now they're three terms.
Now they offer many advantages over probiotics, okay? Because postbiotics are not live products. They are generally more stable and could have a better shelf life as compared to probiotics. Also, postbiotic could also be possibly used in people who can't take probiotics. Now, such as people who are immunocompromised, as we have mentioned earlier. But while this But most research has to be done for postbiotic, but it's definitely an upcoming topic of interest.
Yes. Okay. All right, I think if there are no more questions, that's all for today's session. Thank you everyone for joining us today in live session for the probiotics. We hope that the session has been informative for you.
Do remember to to like and share the video if you found it useful and interesting. Now see you in store.
Bye bye.